Hello guys, good evening. I welcome you all on Unacademy, India's largest learning platform. Myself, Dr. Nidhi, I'm your physiology educator at Unacademy. This is the Telegram page. Let's crack NEET PG. Follow us out there so that you'll get link of every classes out here. This is my page on Unacademy, unacademy.com/@KGMC. Follow me out there so that you'll get every link, every classes out there. Notification आपको ऐप के थ्रू भी मिल जाता है so that you will not miss any single class. This is a code Dr. Nidhi. If you want to join any paid course, you can use this referral code to get additional 10% off. I taken many plus classes, many special classes, so anytime you can join and revise the topic. We are launching this MBBS professional course. If you are in first prof, you can join this क्योंकि इसमें हम we are going to cover the all the concept in the detail. Clinical integrated session will be there, answer writing guiding session will be there, subjects wise test we will conduct this on every Saturday and we will discuss that on Monday also. Full subject wise test होगा after completion of the subject. Live interactive classes will be there, doubt clearing session will be there. अगर किसी वजह से सेशन मिस हो जाता है, you can see the recorded version also, and we will download the PDF so that you can download the PDF and revise it anytime, anywhere. We have this doubt clearing clarification series जो कि हम 6 April onward start कर रहे हैं. This is for the only the Plus platform. So get your subscription right now, everybody. Now coming to the subscription, we have two type of subscription: Plus subscription or Iconic subscription. Now coming to the benefit of all the Plus subscription, if you are able to access both the live and recorded session, अगर किसी वजह से आपका session miss हो जाता है तो you can see the recorded version. You have an opportunity to learn from India's top educator for the medical examination. We always conduct this live tests and live quizzes. From that you can analyze your preparation at any point of time. You have a flexibility, you can study on the device of your choice. आपका phone हमेशा आपके साथ होता है. हेलो डॉक्टर प्रदीप, आपका फ़ोन हमेशा आपके साथ होता है, फ़ोन से एक्सेस कर सकते हो. इफ यू वांट टू गो फॉर द बिगर स्क्रीन, यू कैन गो फॉर द बिगर स्क्रीन. वी हैव अ क्वेश्चन बैंक विच कंसिस्ट ऑफ 25,000 प्लस क्वेश्चन. हाई यील्ड क्वेश्चन है, क्लिनिकल बेस्ड क्वेश्चन एंड विद एक्सप्लेनेशन है. सो दिस इज गोइंग टू बी वेरी बेनिफिशियल फॉर ऑल ऑफ यू. नाउ कमिंग टू द आइकॉनिक सब्सक्रिप्शन वेयर यू गेट इंडियाज टू बेस्ट प्लेटफॉर्म एक्सेस, दैट इज Unacademy and the Prep Ladder. So you are going to get all the plus benefit. Like I said, live classes, recorded classes, question bank, live tests, live quizzes and the PDF. You will also get access of Prep Ladder along with that. In this you can access the clinical and integrated essential of Prep Ladder video lecture from the dream team, question bank 3.0, rapid revision and snapshot, and you will also be provided with that treasure and dream notes. So this is our FMG December 2021 topper. Special class feature की बात करेंगे तो हमारा special class is also free of cost, but they are way more special. How they are special? Because our special class is always and always live. Live classes का benefit क्या होता है कि you can interact with your educator in the live session. अगर किसी session में अगर कोई doubt है तो आप live session में ही clear कर सकते हो. पोल्स के फीचर होते हैं जिससे क्लास काफ़ी इंगेजिंग होता है. रेज अ हैंड फीचर इज देयर. नाउ यू कैन टॉक टू एजुकेटर इन द लाइव सेशन. अगर किसी एजुकेटर को फॉलो करते हो तो उनकी क्लास से प्रायर आपको नोटिफिकेशन मिल जाता है. आफ्टर लेक्चर यू कैन डाउनलोड द PDF and revise it anytime, anywhere. We are going to start with this high-yield theory revision batch. NEET PG 2022. If you are targeting this one, you can join this revision batch which we are going to start from 30th March and that will last till 15th May. यानी total 1.5 month duration होगा. 140 hour revision classes होंगे, recorded classes होंगे, grand test होंगे, questions bank होंगे, live classes होंगे. So do enroll yourself if you are targeting this NEET PG 2022. We are going to start this also high yield revision and MCQ batch. If you are targeting this FMG 2022, you can enroll yourself in this batch. इस batch की duration है 2 months. So काफ़ी अच्छा रहेगा अगर आप enroll करते हो, अगर आपका target FMG 2022 है. So now coming to the subscription, we are going to start with the fee structure. Plus subscription अगर लेते हैं तो 2 month की फीस है 7,650, 6 month fee is 20,250, 9 month fee is 22,500, 1 year fee is 24,750, 18 month fee is 29,250, 2 year fee is 36,000 and 36 month fee कितना है 45,000 है. 48 month fee is 54,000. Iconic subscription की बात करेंगे तो fee structure is somewhat like this. 6 month fee is 36,000, 9 month fee is 39,600, 1 year fee is 43,000, 218 month fee is 49,500, 2 year fee is 54,900, 36 month fee is 63,000 and 48 month fee is 70,200 only. Now coming to the light subscription, its fee structure is somewhat like this. Light subscription में क्या है कि you can access the all the tests. 2 month fee is 2,160, 3 month fee is 2,750, 6 month fee is 1,860, 9 month fee is 5,400 and 1 year fee is 5,940. तो बहुत इकोनॉमिकल सब्सक्रिप्शन है, तो अपने रिक्वायरमेंट के हिसाब से you can purchase the subscription. Now coming to the topic we are going to revise is first, that is diffusion and transport of gas. First coming to the introduction part, inspired air contain more oxygen and less carbon dioxide, जबकि deoxygenated blood that is coming to lung for oxygenation is containing less oxygen and more carbon dioxide. So हम देख रहे हैं कि we are seeing this concentration gradient and we all know diffusion happen along the concentration gradient. From higher concentration our gases move from higher concentration to lower concentration via the process of diffusion, and this diffusion required the respiratory membrane. Next important point is deoxygenated blood stay inside the vessel for 0.8 second, और इसी 0.8 second में क्या होगा, diffusion will have to be happen. ठीक है, so this 0.8 second is important because इसी second में हमारा deoxygenated blood vessels में होता है. So now coming to the simple diffusion, क्योंकि हमारा जो भी gaseous exchange है that occurs by the simple diffusion. So now coming to this one. This is a passive process and this follows the Fick's law. What does Fick's law state? Diffusion is directly proportional to the concentration gradient. More the concentration gradient, higher will be the rate of diffusion. It is directly proportional to this area. More the surface area of the membrane, more will be the diffusion. It is inversely proportional to the thickness of membrane. जितना ज़्यादा thick membrane होगा, diffusion rate is least. Diffusion is directly proportional to the solubility. More the substance is lipid soluble, more will be the rate of diffusion. Diffusion is inversely proportional to the size of particle. जितना बड़ा साइज होगा डिफ्यूजन रेट क्या होगा, दैट इज गोइंग टू बी लेस. अब बात करेंगे हमारा डिफ्यूजन कब डिक्रीज होता है, एरिया डिक्रीज हो जाए या थिकनेस ऑफ मेम्ब्रेन इंक्रीज हो जाए. तो क्लिनिकल एस्पेक्ट की बात करेंगे तो एरिया इंक्रीजेस इन द एम्फाइसेमा. एम्फाइसेमा में क्या होता है, सरफेस एरिया डिक्रीज होता है. सरफेस एरिया डिक्रीज होता है तो क्या होगा, डिफ्यूजन रेट डिक्रीज होगा. थिकनेस, हमारा पल्मोनरी फिब्रोसिस में क्या होता है, मेम्ब्रेनल थिकनेस इंक्रीज होता है. So that's why diffusion is going to decrease in this situation. Is this clear with everybody? Do reply fast. दोनों clinical aspect clear है? Moving further. Now coming to the diffusion measurement. How we measure this diffusion? Diffusion को measure करने के लिए we use this Delco test. That is diffusion capacity of lung for carbon monoxide. Why we are using this carbon monoxide? Because carbon monoxide has 210 times more affinity to hemoglobin as compared to oxygen. ठीक है, carbon monoxide की affinity to the hemoglobin is 210 times more as compared to oxygen. That's why we are using this carbon monoxide to measure the diffusion capacity. Normal diffusion capacity of carbon monoxide is 25 ml per minute per mm of Hg. So how we measure this one? We measure this one by this formula. Delco is equal to carbon monoxide uptake in the blood upon partial pressure of carbon monoxide in the alveoli minus partial pressure of carbon monoxide in the blood. So this is going to give us this value of delco, that is normally it is 25 ml per minute per mm of Hg. और normal patient में we all know blood में carbon monoxide क्या होता है, zero होता है. So that's why this becomes zero. So normal patient में अगर बात करेंगे तो delco का formula क्या हो जाएगा, carbon monoxide uptake in the blood upon partial pressure of carbon monoxide in the alveoli. So this formula is important, do remember everybody. So now coming to the clinical aspect, there are some situations where diffusion capacity of lung for carbon monoxide decreases. There are some situations where diffusion capacity of lung for carbon monoxide is going to increase. अभी just बात किया था emphysema में क्या होता है, emphysema में area decrease होता है, diffusion capacity decreases. Pulmonary fibrosis में क्या है, thickness of membrane increases, so the diffusion decreases. So first is emphysema, second is pulmonary fibrosis, and next was anemia. Anemia में क्या है, RBC count is less, and RBC count less है तो सिचुएशन में हीमोग्लोबिन काउंट लेस है तो उस सिचुएशन में क्या होगा, डिफ्यूजन कैपेसिटी ऑब्वियसली इट गोइंग टू डिक्रीज. नेक्स्ट इज द सिचुएशन जहाँ पे हमारा डिफ्यूजन कैपेसिटी ऑफ लंग इंक्रीजेस, it is during the polycythemia. Polycythemia में RBC number is more, and since RBC number is more, hemoglobin will be more, and that's why the diffusion capacity of lung for carbon monoxide increases. Physiological situation like exercise, उस समय भी क्या होता है, हमारा relative polycythemia occurs, and that's why in that situation also diffusion capacity of lung for carbon monoxide increases. ठीक है, clear everybody? Moving further, this point is also important. Carbon dioxide is 20 times more soluble as compared to oxygen. Do you remember? ठीक है, अब बात करते हैं टॉपिक पे, दैट इज ट्रांसपोर्ट ऑफ गैस. इसमें ऑक्सीजन ट्रांसपोर्ट होगा, कार्बन डाइऑक्साइड ट्रांसपोर्ट होगा. फर्स्ट कमिंग टू दिस ऑक्सीजन ट्रांसपोर्ट. ऑक्सीजन क्या है, हमारा कंबाइन कर जाता है हीमोग्लोबिन से एंड इट फॉर्म ऑक्सी हीमोग्लोबिन. एंड 97% अगर बात करें ट्रांसपोर्ट की ऑक्सीजन की, दैट अगर इन द फॉर्म ऑफ ऑक्सी हीमोग्लोबिन. रेस्ट 3% जो हमारा ऑक्सीजन का ट्रांसपोर्ट होता है, दैट इज डिसॉल्व इन द प्लाज्मा. नेक्स्ट इज आवर कार्बन डाइऑक्साइड ट्रांसपोर्ट. Carbon dioxide combine with the hemoglobin and form carb amino hemoglobin. Carbon dioxide plus hemoglobin, carb amino hemoglobin. Minor form of transport है. 30% around हमारा जो carbon dioxide का transport होता है, that occur in the form of carb amino hemoglobin. And rest जो major part है, that occur in the form of bicarbonates. ठीक है, तो 27% हमारा in the form of carb amino hemoglobin, 70% in the form of bicarbonate, and rest 3% is in the form of dissolved in the plasma. So this is about the carbon dioxide transport. अब इसी को डिटेल में देखते हैं. Now coming to the oxygen का क्या पार्शियल प्रेशर होता है डिफरेंट लेवल पे. तो इन्वायरमेंटल एयर की अगर बात करते हैं तो 21% ऑक्सीजन होता है. तो इन्वायरमेंटल एयर हैज अ पार्शियल प्रेशर ऑफ ऑक्सीजन ऑफ 160 mm of Hg. ऑन इंस्पिरेशन क्या होगा, एयर हमारा लंग्स पे आता है, लंग के एपिथेलियल से गेट ह्यूमिडिफाइड एंड ड्यू टू तो ह्यूमिडिफिकेशन की वजह से एयर क्या होगा, डाइल्यूट होगा. So partial pressure of oxygen decreases. So partial pressure of oxygen decreases from 160 to 150 mm of Hg. ठीक है, अब ये एयर हमारे एल्वेलाई में होएगा. एल्वेलाई में गैसियस एक्सचेंज होगा एंड एल्वेलाई में जो एयर का पार्शियल प्रेशर हो जाएगा ऑक्सीजन का, दैट बिकम 104 mm of Hg. ठीक है. डू रिमेंबर डिफरेंट लेवल पे जो पार्शियल प्रेशर ऑफ ऑक्सीजन है दैट इज इंपॉर्टेंट फ्रॉम द एग्जाम पॉइंट ऑफ व्यू. नेक्स्ट बात करेंगे दैट इज द समरी. पार्शियल प्रेशर ऑफ ऑक्सीजन इन एनवायरमेंटल एयर इज 160 दैट इज corresponding to 21% of oxygen. Partial pressure of oxygen in inspired air is 150 mm of Hg. Partial pressure of oxygen in alveolar air is 104 mm of Hg. Partial pressure of oxygen in expired air is 120 and that corresponds to 16% of oxygen. इस पॉइंट पे काफी सारे क्वेश्चन आते हैं. डू रिमेंबर एवरीबडी. इन्वायरमेंटल एयर में हमारा 21% ऑक्सीजन होता है और expired air में we have this 16% of oxygen. So that's why when we are giving this mouth to mouth respiration we are providing 16% oxygen to the patient. ठीक है. आर्टेरियल ब्लड की में बात करेंगे तो आर्टेरियल ब्लड में पार्शियल प्रेशर ऑफ ऑक्सीजन इज 95 mm of Hg. Partial pressure of oxygen in venous blood is 40 mm of Hg. So all these points are very important. Do remember everybody. Moving further to the diagram, this is the partial pressure of oxygen in inspired air. On humidification हमारा decrease होगा, so it decreases to 150 mm of Hg. At the level of alveolar gaseous exchange होगा, it reaches to 104 mm of Hg. हमारा deoxygenated blood में partial pressure of oxygen कितना होता है 40 mm of Hg and हमारा oxygenated blood में it is approx 100 mm of Hg. और कार्बन डाइऑक्साइड की बात करेंगे तो पार्शियल प्रेशर ऑफ कार्बन डाइऑक्साइड इन डीऑक्सीजनेटेड ब्लड इज 46 and in oxygenated blood it is 40. Alveolus में भी कितना हो जाएगा पार्शियल प्रेशर ऑफ कार्बन डाइऑक्साइड एट द लेवल ऑफ alveolus is also 40. Is this clear with everybody? Do you reply first? Is this clear? So different level पे partial pressure of oxygen, partial pressure of carbon dioxide. Do remember. Moving further to the detail of this oxygen transport in the blood. 90% हमारा किसके फॉर्म में होता है ऑक्सी हीमोग्लोबिन के फॉर्म में होता है. एंड वी ऑल नो 1 ग्राम ऑफ हीमोग्लोबिन से कितना मॉलिक्यूल ऑफ ऑक्सीजन ट्रांसपोर्ट होता है. इट कैन ट्रांसपोर्ट 1.34 ml of oxygen. So 15 gram of hemoglobin will carry 20 ml of oxygen. So we can say our oxygen carrying transport of blood is 20 ml of oxygen per 100 ml of blood. ठीक है. Is this clear? So ऑक्सी हीमोग्लोबिन के फॉर्म में मेजर ट्रांसपोर्ट है. माइनर ट्रांसपोर्ट क्या है डिसॉल्व इन द फॉर्म ऑफ प्लाज्मा. अब जो प्लाज्मा में जो डिसॉल्व होगा ऑक्सीजन दैट इज गोइंग टू डिटरमाइन द पार्शियल प्रेशर ऑफ ऑक्सीजन. किसी भी गैस का पार्शियल प्रेशर कब होगा व्हेन इट इज डिसॉल्व इन प्लाज्मा. ठीक है. एंड डिसॉल्व के लिए जो डेटा है दैट इज 0.3 ml of oxygen dissolved in per deciliter of blood and this formula is important. Dissolved oxygen content is equal to partial pressure of oxygen into solubility coefficient of oxygen. And solubility coefficient of oxygen कितना होता है 0.003 ml per 100 ml per mm of Hg. Excuse me. This formula is important to remember. When dissolved oxygen content अगर निकालना हो तो it is equal to partial pressure of oxygen बताओ into solubility coefficient. Solubility coefficient of oxygen is 0.003 ml per 100 ml per mm of Hg. Moving further to the oxygen utilization coefficient. What do you mean by this oxygen utilization coefficient? 100 ml of blood is carrying 20 ml of oxygen and जबकि इसमें से अगर टिश्यू की बात करें तो टिश्यू एक्सट्रैक्ट ओनली 5 ml. सो 20 ml का 5 ml यानी यूटिलाइजेशन कोफिशिएंट कितना हो गया 25%. Is this clear with everyone? समझ में आया ऑक्सीजन यूटिलाइजेशन कोफिशिएंट क्या है 20 ml इज कैरिड बाय ब्लड 100 ml ऑफ ब्लड और टिश्यू कितना एक्सट्रैक्ट कर रहा है इट इज एक्सट्रैक्टिंग ओनली 5%. तो यूटिलाइज कितना हो रहा है ओनली 25%. So utilization coefficient of oxygen is only 25%. Yeah, or you can say arteriovenous oxygen difference is 25%. ठीक है, clear? So moving further, this arteriovenous oxygen difference is highest in the heart. Means heart extract more oxygen from our blood. Approx 75% of oxygen is extracted from our heart. By our heart. Oxygen extraction by the kidney is lowest. It is only 10%. So do remember this oxygen utilization coefficient या arteriovenous difference is highest in our heart 75% and it is lowest in our kidney that is 10% only. So now coming to the next point, that is respiratory exchange ratio. What do you mean by this respiratory exchange ratio? Respiratory exchange ratio is volume of carbon dioxide produced per volume of oxygen used. This is our respiratory exchange ratio. Volume of carbon dioxide produced upon volume of oxygen used. This is respiratory exchange ratio. और स्टीडी कंडीशन में अगर बात करेंगे it is also known as the respiratory quotient. ठीक है, this respiratory quotient for patient having mixed diet is 0.8. For carbohydrate diet, patient having carbohydrate diet, the respiratory quotient is 1. Patient having fat rich diet, the respiratory quotient is 0.72. Protein rich diet अगर patient ले रहा है तो उस situation में respiratory quotient is 0.8. Moving further to the next important topic of today's session, that is ODC curve, oxygen hemoglobin dissociation curve. बिल्कुल एक क्वेश्चन बिल्कुल फॉर श्योर रहता है हमारे एग्जामिनेशन में मोस्ट ऑफ द केसेस में. सो ऑक्सीजन डिसोसिएशन कर्व के लिए फर्स्ट इंपॉर्टेंट पॉइंट, द शेप ऑफ दिस कर्व इज सिग्मोइड. पार्शियल प्रेशर ऑफ ऑक्सीजन 100 mm ऑफ Hg क्या है, प्लेटू फेज इज रीच्ड एंड पार्शियल प्रेशर ऑफ ऑक्सीजन 27 mm ऑफ Hg क्या होता है 50% सैचुरेशन. मीन्स 100% saturation कब होगा 100 mm of Hg पे. 50% saturation of hemoglobin occur at 27 mm of Hg. So that's why this 27 mm of Hg is known as P50. Means partial pressure at which 50% saturation of hemoglobin occur is 27 mm of Hg. This is for our hemoglobin. अगर myoglobin की बात करते हैं तो P50 for the myoglobin is 5 mm of Hg, and that's why the shape of ODC curve for myoglobin is the rectangular hyperbola. ठीक है, हमारा हीमोग्लोबिन के लिए शेप कैसा है सिग्मोइड. P50 कितना है 27. For myoglobin it is 5 mm of Hg and shape is rectangular hyperbola. So see, this is the diagram showing our 100 mm of Hg पे we are getting this plateau phase which is indicating 100% oxygen saturation. ठीक है, 100 mm of Hg पे we are getting this plateau phase which is indicating our 100% saturation. At 27 mm of Hg we are getting this 50% saturation of hemoglobin. So that's why it is known as P50. Shape कैसा है, it is sigmoid in shape. Moving further to the myoglobin, myoglobin में P50 is 5 mm of Hg. So that's why this is the 50% saturation of myoglobin and it is 5 mm of Hg. So that's why the shape is a rectangular hyperbola. Moving further, we all know one molecule of hemoglobin से कितना molecule of oxygen combined होता है 4 molecule of oxygen binds with the 1 molecule of hemoglobin. So normally क्या होता है जब first molecule of oxygen bind करता है hemoglobin से तो there is breakage of some salt bridges and salt bridges break होगा, rest 3 oxygen molecule easily bind up कर जाता है hemoglobin से and this phenomena is known as the theory of cooperativity. What does this theory of cooperativity states? कि first molecule of oxygen bind tightly with the hemoglobin, due to that breakage of some salt bridges occur, and rest three molecule bind with ease, and this is the cause of sigmoidal shape of ODC curve. ठीक है, तो डू रिमेंबर दिस वन. Theory of cooperativity की वजह से there is sigmoid shape of ODC curve. Now moving to the important point, that is shifting of this ODC curve. The ODC curve can either shift to right, which is also known as Bose effect. This ODC curve can either shift to left, which is also known as Halton effect. First, coming to the right shift of ODC curve. Let me draw the curve for all of you. This is the normal ODC curve, which is sigmoidal in shape. Now coming to the right shift. This is the right shift curve, which is also known as Bose effect. So what we all are seeing in this situation, this is the 50% saturation. So this is the P50 of normal curve. This is the P50 of shifted curve. So what we all are seeing out here, that P50 out here is increased. P50 increase हो रहा है, means higher pressure पे हमारा 50% saturation हो रहा है, तो affinity of hemoglobin क्या हो गया? Affinity obviously decrease हुआ होगा, तभी higher pressure पे हमारा 50% saturation हो रहा है. So affinity decrease. Affinity जब decrease होगा तो oxygen क्या होगा? Oxygen will be released from it, and this release of oxygen occur at the level of tissue. So all these 4 points is important. Now coming to the causes of this right shift, hypoxia causes this right shift. Hypercarbia is going to cause this right shift. Carbon dioxide more hoga, obviously carbonic acid will be more. So acidosis situation will also cause this right shift of ODC curve. Next is 2,3-diphosphoglycerate. क्या होगा? During hypoxia एनारोबिक ग्लाइकोलाइसिस होगा हमारी बॉडी में. एनारोबिक ग्लाइकोलाइसिस का इंटरमीडिएट प्रोडक्ट बनता है 2,3-डाइफॉस्फोग्लिसरेट. सो उस सिचुएशन में भी हमारा ओडीसी कर्व विल शिफ्ट टुवर्ड्स राइट. हाई एल्टीट्यूड की अगर बात करें तो हाई एल्टीट्यूड में भी प्रोलॉन्ग हाइपोक्सिया है, दैट इज गोइंग टू कॉज दिस राइट शिफ्ट. एक्सरसाइज में भी क्या होगा? ऑक्सीजन रिक्वायरमेंट हमारी बॉडी का इंक्रीज होता है, सो टू रिलीज ऑक्सीजन आवर ओडीसी कर्व विल शिफ्ट टुवर्ड्स राइट. Same situation, hypothermia, oxygen requirement is more, so ODC curve will shift towards right. So right shift of ODC curve is known as Bose effect. Is this clear with everybody? So right shift कब कब हो रहा है? It is occurring in the situation of hypoxia, hypercarbia, acidosis, 2,3-diphosphoglycerate, high altitude exercise, and the hypothermia. Is this clear with everybody? Do reply fast. किसी को भी कोई डाउट है तो क्लियर कर सकते हैं. एवरीबडी इज दिस क्लियर? राइट शिफ्ट के बाद वी आर गोइंग टू डिस्कस द लेफ्ट शिफ्ट. अगर राइट शिफ्ट क्लियर है तो गिव मी थम्स अप. So moving further to the left shift. Left shift of ODC curve is also known as Halden effect. To understand this one, let me draw the curve for all of you. This is the normal OHDC curve, and this is during the left shift. So now coming to the P50. and this is the 50% saturation. So this is the 50% saturation for normal curve, and this is the 50% saturation for left shift curve. So for left shift we are seeing this P50 is decrease, means lower pressure पे हमारा 50% saturation occurred. So means affinity of a hemoglobin towards oxygen is increase. So lower pressure पे इसीलिए हमारा 50% saturation हो गया. So affinity is increased, so we can say this there will be loading of oxygen. Affinity increase हुआ है तो oxygen will be loaded, and this loading occur at the level of lung. So left shift occur at the level of lung. Is this clear? Now coming to the causes of left shift. Left shift occur in hypoxia, alkalosis, fetal hemoglobin. Why in fetal hemoglobin? क्योंकि fetal hemoglobin की affinity toward oxygen is more and its affinity towards 2,3 diphosphoglitcerate is less. So fetal hemoglobin में भी क्या होगा? ODC curve will shift towards left. Stored blood में क्या होगा? Glycolysis will not be there. So 2,3 diphosphoglitcerate क्या होगा? Less होगा. तो उस सिचुएशन में OHDC curve will shift towards left. ठीक है. हाइपोथर्मिया में भी OHDC curve कहाँ शिफ्ट करता है? It shift towards left. Is this clear with everybody? So this is the summary. Right shift is also known as, जल्दी जल्दी रिप्लाई करो. Right shift is also known as Bose effect. Left shift is also known as Haldane effect. Right shift में what happens to P50? P50 in right shift increases, means affinity is going to decrease, and affinity decrease होगा, there will be release of oxygen, and this release of oxygen occur at the level of tissue. So this right shift or Bose effect occur at the level of tissue. ठीक है? Is this clear? Haldane effect की बात करेंगे तो Haldane effect में P50 decreases, means affinity is going to increase. So since affinity is increased, तो oxygen क्या होगा? There will be loading of oxygen, and since there is a loading of oxygen, this occur at the level of lungs. Is this clear with everyone? Moving further to the carbon dioxide transport. Major जो transport है, that occur in the form of bicarbonate. Mass 70% transport in the form of bicarbonate, 30% when combined with 27% when combined with the hemoglobin, it form carb aminohemoglobin, and 3% dissolve in the plasma. ठीक है. तो हमारा जो 70% कार्बन डाइऑक्साइड है, that react with the water molecule and it is going to form this carbonic acid in the presence of carbonic anhydrase. This enzyme is most abundantly found in our RBC. और कार्बोनिक एसिड जैसे ही फॉर्म करेगा, it is going to dissociate to form H plus ion and the bicarbonate ion. This bicarbonate ion move from the RBC via this bicarbonate chloride exchanger. And in exchange क्या होगा? Chloride ion move inside the RBC. ठीक है. This chloride ion is osmotically active, so it is bringing water molecule along with itself. So that's why what happened? RBC will become swollen. ठीक है. और जो हाइड्रोजन आयन बना, that is going to be buffered with the hemoglobin. Hemoglobin इसको buffer कर देगा. This bicarbonate is going to reach outside, and in exchange chloride ion move inside the RBC, and RBC में हमारा along with the chloride ion water ion also move because it is osmotically active substance. So that's why RBC becomes swollen, and this exchange of bicarbonate and chloride ion is also known as Hamburger's phenomena, chloride shift or Hamburger's phenomena. Is this clear with everybody? See, Same thing is written out here. Channel protein involved out here is bicarbonate chloride exchanger. Exchanger है, so it is a classical example of secondary active transport. Or you can say this is an ion exchanger. So for every bicarbonate ion moving outside the RBC, one chloride ion move inside the RBC to maintain the electron neutrality, and this is known as the chloride shift or Hamburg's phenomena. ठीक है. H plus ion क्या होगा? H plus ion in the RBC will be buffered by hemoglobin. Is this clear with everybody? This is about bicarbonate exchange. So chloride ion is osmotically active substance, so it brings water molecule along with it. So RBC becomes swollen. So that's why packed cell volume of a venous blood is more. Because of this swollen RBC, packed cell volume venous blood का क्या होगा? That is going to be increased. ठीक है? This point is also important from the exam point of view. To remember everybody. ठीक है? अभी तक सेशन में किसी को कोई डाउट? Anybody, any query till now you can ask in the session only. समझ में आ रहा है सेशन? Everybody do reply fast. Chalo, moving further to the next, that is carbon dioxide dissociation. Venous partial pressure of carbon dioxide कितना होता है? 45 mm of Hg. So ये हमने y axis पे क्या लिया है? Carbon dioxide in blood, and x axis पे क्या लिया है? Gas pressure of carbon dioxide. So at 45 mm of Hg, this is the 45 mm of Hg. उस समय अगर कार्बन डाइऑक्साइड कंसंट्रेशन इन ब्लड की बात करेंगे, so it is 52. At 45 mm of Hg, कार्बन डाइऑक्साइड का कंटेंट कितना होता है ब्लड में? That is 42 ml per 52 ml कार्बन डाइऑक्साइड पर डेसीलीटर ऑफ ब्लड. ठीक है. 40 mm of Hg हमारा आर्टीरियल ब्लड में कार्बन डाइऑक्साइड का कंसंट्रेशन होता है. सो उस पे हमारा जो कार्बन डाइऑक्साइड कंटेंट होगा उस समय हमारे ब्लड में, दैट इज 48 ml per deciliter of blood. So these two data is important, and इससे हम कह सकते हैं, we can say this one, this that is 4 ml of carbon dioxide is transported. ठीक है. वीनस ब्लड से हमारा आर्टीरियल ब्लड में कितना डिफरेंस आया? 4 ml का. So we can say this 4 ml of carbon dioxide is transported at the level of lungs. Now coming to the next topic, this is also important one, that is ventilation and perfusion. So now coming to the first of all, what is the ventilation, what is the perfusion? Introduction part पे आ जाते हैं. Ventilation, the air in the lung is known as ventilation, and this tidal volume is our ventilation. What is perfusion? The deoxygenated blood that is reaching to our lungs for oxygenation is known as our perfusion. ठीक है. तो वेंटिलेशन क्या हो गया? वेंटिलेशन आर टाइडल वॉल्यूम. अब इसमें एनवायरमेंटल एयर का कंपोजिशन की बात करेंगे तो नाइट्रोजन कंटेंट इन आवर एनवायरमेंटल एयर इज 79%, दैट इज मैक्सिमम वन. ऑक्सीजन कंटेंट कितना होता है? 21%, एंड कार्बन डाइऑक्साइड इन आवर एनवायरमेंटल एयर इज nil, it is 0. ठीक है. और एनवायरमेंटल एयर के प्रेशर की बात करेंगे तो इट इज 760 mm of Hg. Now coming to the partial pressure. What is partial pressure? एक इंडिविजुअल गैस कितना प्रेशर एक्सर्ट कर रहा है among the group is known as partial pressure. So first coming to the partial pressure of oxygen. ऑक्सीजन का कंटेंट कितना होता है एनवायरमेंटल एयर में? इट इज 21%. So 760 mm हमारा टोटल प्रेशर है, उसका 21% इज कंट्रीब्यूटेड बाय ऑक्सीजन, सो इट इज 160 mm of Hg. So partial pressure of oxygen is 160 mm of Hg in our environmental air. So हमारा 21% जो ऑक्सीजन प्रेजेंट है environmental air में, that is known as fractional concentration of oxygen in our environment. So it is 21%. FiO2 को हम कह सकते हैं it is 0.21. ठीक है, इज दिस क्लियर? सो नेक्स्ट सेम थिंग इज रिटन आउट इन्वायरमेंटल एयर में पार्शियल प्रेशर ऑफ ऑक्सीजन 160, ह्यूमिडिफिकेशन की बात हो जाएगा 150, गैसियस एक्सचेंज के बाद एल्वियोलस के लेवल पे 104 mm of Hg. So now coming to the next topic, that is alveolar gas equation. ठीक है, alveolar gas equation से we calculate how this partial pressure of oxygen at the level of alveolus is 104 mm of Hg. ठीक है, so this is the formula. Partial pressure of oxygen at the level of alveolus is equal to partial pressure of oxygen in the inspired air minus partial pressure of carbon dioxide at the level of alveolus upon respiratory exchange ratio. अभी जस्ट पढ़ा था हमने, रेस्पिरेटरी एक्सचेंज रेशियो क्या होता है? वॉल्यूम ऑफ कार्बन डाइऑक्साइड प्रोड्यूस अपॉन वॉल्यूम ऑफ ऑक्सीजन यूज. सो इसको यूज करेंगे एंड वी कैन गेट दिस पार्शियल प्रेशर ऑफ ऑक्सीजन एट द लेवल ऑफ alveoli. We all know the respiratory exchange ratio in the normal situation having patient having mixed diet is 0.8. ठीक है, this formula is also important. Partial pressure of oxygen in inspired air is equal to fractional concentration of oxygen into barometric pressure minus water vapor pressure. ठीक है, ये फॉर्मूला भी बिल्कुल याद रखिएगा. पार्शियल प्रेशर ऑफ ऑक्सीजन इन इंस्पायर्ड एयर इज इक्वल टू फ्रैक्शनल कंसंट्रेशन ऑफ ऑक्सीजन इनटू पार्शियल प्रेशर ऑफ barometric pressure minus water vapor pressure. So barometric pressure is 760, water vapor pressure is 47 mm. ठीक है, दिस इज द समरी. एनवायरमेंटल एयर में ऑक्सीजन का पार्शियल प्रेशर कितना होता है? 160. इंस्पायर्ड एयर में ह्यूमिडिफिकेशन की वजह से इट बिकम 150. एल्वेलर एयर में इट इज गोइंग टू डिक्रीज एंड इट डिक्रीजेस टू 104. एंड एक्सपायर्ड एयर इट इज 120 mm of Hg, which corresponds to 16% of oxygen. Means in mouth to mouth respiration we are providing this expired air, so we are providing the 16% oxygen to the patient. Now coming to the next, that is minute ventilation. What do you mean by this minute ventilation? Tidal volume into respiratory rate give us this minute ventilation. Tidal volume कितना होता है? 500 ml. Respiratory rate कितना होता है? 12. So normal tidal volume minute ventilation is 6 liter per minute. ठीक है, मिनट वेंटिलेशन कितना होता है? 6 लीटर पर मिनट. अब टाइडल वॉल्यूम हम वी ऑल नो एक्सक्यूज मी, इट इज 500 ml. इस टाइडल वॉल्यूम का 150 ml गोज टू द डेड स्पेस वेंटिलेशन. मीन्स यहाँ पे वेंटिलेशन जो होगा वो वेस्टेड होगा, नो गैसियस एक्सचेंज. ओनली एंड ओनली 350 ml इज participating in the alveolar ventilation. So useful ventilation कितना हो गया? Only 350 ml. 150 ml क्या होता है? Useless होता है, no gaseous exchange occur. ठीक है, this dead space ventilation is in our conducting airway. पढ़ा ना, conducting airway and exchange airway according to the Weibel's model. So the air that is present in our conducting airway is 150 ml, which is corresponding to the useless ventilation, which is not going to involve in the gaseous exchange. So useful ventilation की अगर बात करें तो हमारा सिर्फ 350 ml है. So first formula was minute ventilation, next is the alveolar ventilation. ठीक है, alveolar ventilation क्या हो जाएगा? Tidal volume into respiratory rate. So normal minute ventilation 6 liter per minute का होता है. Normal alveolar ventilation कितना हो जाएगा? 4 liter per minute. Is this clear everybody? अब फर्स्टली हम इसको बात कर लेते हैं डेड स्पेस वेंटिलेशन जो 150 ml है उसके बारे में. सो डिफरेंट टाइप ऑफ डेड स्पेस वेंटिलेशन आर देयर. एनाटॉमिकल डेड स्पेस, alveolar dead space and the physiological or total dead space. ठीक है, this physiological or total dead space तो derived one है. First coming to the anatomical dead space. तो हमारा वीवल मॉडल के अकॉर्डिंग जो कंडक्टिंग एयरवे है, दैट इज फर्स्ट 16 जनरेशन ऑफ वीवल मॉडल इज आर कंडक्टिंग एयरवे एंड दैट कॉरेस्पॉन्ड्स टू दिस एनाटॉमिकल डेड स्पेस ऑफ 150 ml. ठीक है, और हेल्दी इंडिविजुअल में अगर हम एल्वेलर डेड स्पेस की बात करते हैं तो इट इज 0. इट इज ऑलवेज एंड ऑलवेज प्रेजेंट इन सम पैथोलॉजिकल कंडीशन ओनली. इज दिस क्लियर? Next is the physiological or total dead space. Physiological or total dead space is equal to anatomical dead space plus alveolar dead space. So healthy individual की अगर बात करेंगे तो हमारा alveolar dead space is 0. So this anatomical dead space is equal to physiological dead space in a normal healthy individual. Is this clear with everybody? अब बात करते हैं how this dead space is measured. Anatomical dead space measure करने के लिए we use this Fowler's method which is also known as single nitrogen breath method. Next is the physiological dead space. Physiological dead space को we use this Bose method. Bose method क्या है? Physiological dead space is equal to tidal volume into partial pressure of carbon dioxide in the alveolar air minus partial pressure of carbon dioxide in the expired air upon partial pressure of carbon dioxide in the alveolar air. This formula gives us this physiological dead space. Is this clear with everybody? So physiological dead space is equal to tidal volume and physiological dead space upon tidal volume ratio क्या हो जाएगा? Partial pressure of carbon dioxide at the level of alveolus minus partial pressure of carbon dioxide in the expired air upon partial pressure of carbon dioxide in the alveolar air. This formula gives us this ratio, dead space upon tidal volume ratio. ठीक है, इस रेशियो में हमारा डेड स्पेस कितना है 150 ml, टाइडल वॉल्यूम कितना है 500 ml. सो दिस रेशियो इज 30%. Is this clear everyone? सेम थिंग जो अभी हमने बात की थी एल्वेलर वेंटिलेशन. तो यूजफुल वेंटिलेशन हमारा कितना है 350 ml. So 350 ml into respiratory rate gives us this alveolar ventilation and it is 4 liter per minute. So we have two terms, alveolar ventilation and minute ventilation. Is this clear? दोनों में डिफरेंस याद रहेगा. Everybody, minute ventilation is our tidal volume into respiratory rate. So it is 6 liter per minute. जबकि alveolar ventilation की अगर बात करेंगे तो it is 4 liter per minute only. ठीक है, everybody is this clear? किसी को भी कोई डाउट है तो क्लियर कर सकते हैं. Anybody, any query? Do reply fast. किसी को भी कोई डाउट है सेशन में तो क्लियर कर सकते हैं. एनीबडी, एनी क्वेरी? चलो फिर फर्दर मूव करते हैं. Now coming to the zones of ventilation. In lungs, we have 3 zones according to the ventilation in our lungs. That is zone 1, zone 2 and zone 3. First coming to the zone 1. Zone 1, this is present at the apex of lung, and apex of lung में we are seeing the alveolar sizes more. So there is increase in size of alveoli. So that's why क्या है इसमें compliance जब alveoli large होती है compliance is less stretching ability is less. So that's why ventilation at the apex of lung is minimum. It is 1.92 liter per minute. और zone 2 that is present at the मिडिल लोब में क्या है इंटरमिटेंट साइज ऑफ एल्वेलाई है तो यहाँ पे वेंटिलेशन भी इंटरमिटेंट होगा दैट इज 4 लीटर पर मिनट zone 3 that is present at the base of lung and at the base of lung we are seeing alveoli size are small so smaller alveoli has better compliance its stretching abilities and that's why ventilation at the base of lung is more it is 6.5 liter per minute. So these are different three zones in our ventilation. Is this clear? So now coming to the perfusion. Perfusion already discussed. It is the pulmonary circulation that is reaching to our lung for its oxygenation is known as perfusion. So हमारा जो entire output cardiac output है that goes to the lung for oxygenation. So normal pulmonary circulation per minute की बात करेंगे तो it is 5 liter per minute. Perfusion के लिए pulmonary circulation involved है so we are having three components of this perfusion pulmonary artery pulmonary capillary and pulmonary vein pulmonary artery is carrying the deoxygenated blood to the lung the oxygenated blood reaches to heart via this vein and capillary is the level जहाँ पे oxygenation occurs so we have three components of our perfusion pulmonary artery pulmonary capillary and the pulmonary vein moving further our pulmonary circulation is high compliant circulation. What do you mean by this high compliant circulation? अगर सिस्टमिक सर्कुलेशन से कंपेयर करेंगे पल्मोनरी वेसल्स की तो दैट इज 25% मोर 24% मोर कॉम्प्लाइंट होता है मीन्स दे आर मोर स्ट्रेचेबल एज कंपेयर टू सिस्टमिक पार्ट सो दे कैन स्ट्रेच एंड दे कैन accommodate large amount of blood. So that's why lung is also known as a reservoir of blood. 15 to 18% of total blood is always and always present in our lung. ठीक है pulmonary circulation is high compliant circulation. Pulmonary vessels are 24% more compliant as compared to the systemic counterpart. They can accommodate large amount of blood. 15 to 18% हमेशा हमारे lungs में present होता है. Is this clear? So now coming to the next important point that is zones of perfusion in our lung. So why there are different zones in our lungs for the perfusion? Because of interplay of this alveolar pressure and the hydrostatic pressure. कैसे interplay होता है? First coming to the zone 1. The zone 1 is present at the apex of lung. And apex of lung की अगर बात करेंगे तो alveolar pressure is more as compared to arterial pressure. Arterial pressure is more as compared to the venous pressure. So alveolar pressure सबसे ज़्यादा है, so it is going to compress the artery as well as vein. So that's why there is no perfusion in zone 1. ठीक है? No blood flow. Alveolar pressure is maximum, artery and vein get compressed, so there is no blood flow in zone 1. Middle lobe में we have this zone 2. जोन 2 में प्रेशर की बात करेंगे तो आर्टेरियल प्रेशर इज मोर एज कंपेयर टू द एल्वेलर प्रेशर बट आउट हियर आल्सो द वीनस प्रेशर इज लेस एज कंपेयर टू द एल्वेलर प्रेशर सो आर्टेरियल प्रेशर हमारा ज़्यादा है सो आर्टरी कंप्रेस नहीं होगी ओनली एंड ओनली वेन विल बी कंप्रेस सो इस सिचुएशन में वी आर गेटिंग दिस पल्सेटाइल ब्लड फ्लो विच इज ऑल्सो नोन एज वाटरफॉल इफेक्ट. So zone 1 में there is no blood flow. Zone 2 में we have this pulsatile water flow. Last one that is zone 3. This is present at the base of lung and at the base of lung क्या होगा हमारा arterial pressure is more than the venous pressure and venous pressure is more than the alveolar pressure. ठीक है सबसे ज़्यादा क्या होगा हमारा alveolar pressure है. Alveolar pressure सबसे ज़्यादा है. So that's why हमारा ना artery compress है ना vein compress है so there will be continuous blood flow is maximum in zone 3. Is this clear? Zone 1 में there is no blood flow. Zone 2 में we have the pulsatile blood flow. In zone 3 the blood flow is maximum. Upright posture में अगर बात करते हैं तो in upright posture all these three zones are present in our lung. While in supine posture की बात करेंगे तो only and only zone 3 is present throughout the lung. Do remember this one. These all zones are present in upright posture only. Supine posture में we have only the zone 3 in our through our lung. Next point. This is the diagram. This is the zone 1 which is present at the apex of lung, and at the apex of lung सबसे ज़्यादा क्या होता है? Alveolar pressure होता है. So artery get compressed, vein get compressed, so there is no blood flow. And zone 2 क्या होगा? Arterial pressure is more as compared to the alveolar pressure. So artery हमारी compressed नहीं होगी, only and only vein is compressed. So there is pulsatile or waterfall effect. Last one, that is zone 3, that is present at the base of lung, and at the base of lung हमारा सबसे least होता है alveolar pressure. So artery भी compressed नहीं होगी, vein भी compressed नहीं होगा. So there is a continuous blood flow in zone 3. So this is about the perfusion. नेक्स्ट इंपॉर्टेंट पॉइंट है असिस्टेड वेंटिलेशन. असिस्टेड वेंटिलेशन की किस सिचुएशन में क्या हो गया? हमारा पार्शियल प्रेशर ऑफ एल्वेलस इज इंक्रीज. सो जोन 2 इज कन्वर्टेड, जोन 3 इज कन्वर्टेड इनटू जोन 2 and zone 2 is converted into zone 1. Is this clear? Next important point, hypoxia. Most of the organs में क्या करता है? Vasodilate करता है. But hypoxia in lung causes vasoconstriction. Why is it so? See, hypoxia in other organ causes the vasodilation, while in lung it causes vasoconstriction. Why is it so? Because our lung consists of oxygen sensitive potassium channel. ठीक है? And whenever there is a hypoxia, this channel get closed, and due to the closure of this channel, potassium efflux क्या हो जाएगा? Stop हो जाएगा. Potassium ion is going to accumulate inside the cell. Since positive ion is accumulating inside the cell, तो membrane क्या होगा? Depolarize होगा. जैसे ही potential हमारा -40 millivolt पे पहुंचेगा, तो this calcium channel open up. Calcium channel open होगा, calcium influx will start, and that is going to cause the contraction of cell, and that is responsible for the vasoconstricting action in the lung. Now coming to the significance, क्या significance है? Hypoxia induced vasoconstriction in lung. तो blood flow is directed toward a better ventilated alveoli. Lower ventilated, poorly ventilated alveoli में क्या होगा? Vasoconstrict हो जाएगा, blood flow redirect होगा towards the better ventilated alveoli. Is this clear? Moving further to the next, that is the ventilation perfusion ratio. Ventilation is our alveolar ventilation. ठीक है? Alveolar ventilation कितना होता है? Anybody अभी just discuss किया था. Alveolar ventilation is 4 liter per minute. Minute ventilation was 6 liter. Alveolar ventilation was 4 liter. Perfusion की बात करेंगे तो perfusion is our pulmonary circulation. So pulmonary circulation में कितना आता है? Our entire cardiac output, that is 5 liter per minute, reaches to our pulmonary circulation. So this ventilation perfusion ratio 4/5. So this is 0.8 in the normal situation. So ventilation perfusion ratio is 0.8 in the normal situation, and this normal ventilation perfusion ratio is seen only and only in the middle lobe of lung, middle region of lung. Do remember this point. This normal ventilation perfusion ratio is only and only present in the middle region of lung. So now coming to the apex. Apex पे क्या है? हमारा perfusion less है. Ventilation is less, but perfusion is very less. Almost nil है perfusion. So this ratio increases, and at the apex हमारा ventilation perfusion ratio highest होता है, and it is 3.2. Base of lung की बात करेंगे तो perfusion ventilation is more, but perfusion is very more. That's why the ratio is less at the base of lung. So at the base of lung, की बात करेंगे तो ventilation perfusion ratio is 0.6 and at the apex of lung it is highest, it is 3.2. This is important from the exam point of view to remember this one. Moving further, now coming to the ventilation perfusion mismatch. First situation, ventilation perfusion is infinite. कोई भी रेशियो कब इनफाइनाइट होगा? व्हेन डिनोमिनेटर इज 0. ठीक है, सो मीन्स वेंटिलेशन इज देयर बट परफ्यूजन इज नॉट देयर. ठीक है, मीन्स परफ्यूजन ही है यानी ब्लड फ्लो इज नॉट देयर. सो इन दिस सिचुएशन क्या है? वेंटिलेशन इज देयर बट देयर इज नो परफ्यूजन. सो इस समय जो वेंटिलेशन है वो क्या होगा? वेस्टेड हो जाएगा. सो ये कैसा हो गया? वेस्टेड वेंटिलेशन, जहाँ पे कोई गैसियस एक्सचेंज नहीं है. बिकॉज परफ्यूजन ही नहीं है तो गैसियस एक्सचेंज की बात ही नहीं आएगी. सो फर्स्ट इज वेंटिलेशन परफ्यूजन रेशियो इनफाइनाइट. और सेम डायग्राम है, यहाँ पे ब्लड फ्लो इज नॉट देयर बट वेंटिलेशन इज देयर. सो दिस वेंटिलेशन इज वेस्टेड वेंटिलेशन एंड नॉर्मली अगर बात करें तो इट इज प्रेजेंट इन आवर फिजियोलॉजिकल डेड स्पेस. 150 ml हमारा फिजियोलॉजिकल डेड स्पेस होता है ना, वहाँ पे क्या है? वेंटिलेशन इज देयर बट देयर इज नो परफ्यूजन, सो दैट इज वेस्टेड वेंटिलेशन. और सिचुएशन में क्या होगा? वेंटिलेशन परफ्यूजन रेशियो इज इनफाइनाइट. अगर पैथोलॉजिकल कंडीशन की बात करते हैं तो पल्मोनरी एम्बोलिज्म होगा. पल्मोनरी एम्बोलिज्म की वजह से क्या होगा? आर्टरी, हमारी पल्मोनरी आर्टरी क्या होगी? ब्लॉक्ड हो जाएगी. ब्लड फ्लो इज नॉट देयर एंड इस सिचुएशन में क्या होगा? वेंटिलेशन इज देयर बट परफ्यूजन इज नॉट देयर. सो दिस रेशियो इज इनफाइनाइट. First situation clear है everybody? Ventilation perfusion ratio is infinite. Next one, this ventilation perfusion ratio is 0. Means ventilation is not there but there is perfusion. ठीक है, तो इस सिचुएशन में क्या होगा? वेंटिलेशन इज नॉट देयर but there is perfusion. Perfusion is there but there is no ventilation. So ये perfusion क्या हो जाएगा? Waste हो जाएगा. So we can say this perfusion is wasted perfusion or shunted perfusion. Means यहाँ पे भी कोई gaseous exchange नहीं होगा क्योंकि ventilation ही नहीं है. ठीक है, अगर एग्जाम्पल की बात करें तो नॉर्मली 2% ऑफ कार्डियक आउटपुट ऑलवेज एंड ऑलवेज गो इनटू दिस शंट परफ्यूजन. पैथोलॉजिकल बात करें तो अगर हमारे रेस्पिरेटरी ट्रैक में फॉरेन बॉडी ऑब्स्ट्रक्शन है तो एयरवे बिलो द ऑब्स्ट्रक्शन आर गोइंग टू बी कोलैप्स्ड. सो देयर इज नो वेंटिलेशन बिलो दैट ऑब्स्ट्रक्शन. सो उस सिचुएशन में क्या होगा? वेंटिलेशन परफ्यूजन रेशियो इज 0. सी दिस इज द डायग्राम. सपोज दिस इज आवर ऑब्स्ट्रक्शन, तो यहाँ पे क्या होगा? देयर विल बी नो वेंटिलेशन, ओनली एंड ओनली परफ्यूजन इज देयर. सो इस सिचुएशन में परफ्यूजन क्या हो जाएगा? वेस्ट हो जाएगा और शंट हो जाएगा. इज दिस क्लियर? सो वेंटिलेशन परफ्यूजन इनफाइनाइट. नेक्स्ट इज वेंटिलेशन परफ्यूजन रेशियो इज 0. ठीक है, नेक्स्ट सिचुएशन आ जाते हैं हम अपने डायग्राम पे. वेंटिलेशन परफ्यूजन डायग्राम विच इज ऑल्सो नोन एज ऑक्सीजन कार्बन डाइऑक्साइड डायग्राम. तो अभी जस्ट हमने बात की थी वेंटिलेशन परफ्यूजन इनफाइनाइट. ये कहाँ होता है? हमारे फिजियोलॉजिकल और एनाटॉमिकल डेड स्पेस में. वहाँ पे क्या है? वेंटिलेशन इज देयर बट देयर इज नो परफ्यूजन, इसलिए कोई गैसियस एक्सचेंज नहीं होगा. सेम थिंग डायग्राम में देखेंगे. This is the alveoli जहाँ पे ventilation is there but there is no perfusion. Since there is no perfusion तो हमारा जो इंस्पायर्ड एयर में जो ऑक्सीजन कंटेंट होगा या कार्बन डाइऑक्साइड कंटेंट होगा that is also in our alveoli. Is this point clear with everybody? तो इंस्पायर्ड एयर में ऑक्सीजन का पार्शियल प्रेशर कितना होता है? 149 और 150 mmHg. Partial pressure of carbon dioxide in inspired air is 0. So we can say this one that partial pressure of oxygen at the level of alveoli in this situation is equal to partial pressure of oxygen in the inspired air, that is 149 mm of Hg. We can say this one also, partial pressure of carbon dioxide at alveolus level is equal to partial pressure of carbon dioxide in the inspired air in this situation. Inspired air में we all know carbon dioxide is nil, so it is 0 mm of Hg. ठीक है, ventilation perfusion infinite होगा तो partial pressure of oxygen and carbon dioxide. is this clear? Everybody, moving to the next, that is the ventilation perfusion ratio is 0. कब 0 होगा? जब हमारा ventilation is not there but there is a perfusion. ठीक है, तो यहाँ पे क्या होगा? हमारा perfusion waste होगा, shunted होगा. तो यहाँ पे जो partial pressure of oxygen at the level of alveoli होगा, that is same to the partial pressure of oxygen in the deoxygenated blood. Is this clear? So deoxygenated blood में partial pressure of oxygen is 40 mm of Hg. ठीक है, partial pressure of carbon dioxide at the level of alveolus out here is equal to partial pressure of carbon dioxide in the deoxygenated blood. And deoxygenated blood में carbon dioxide का partial pressure होता है 45 mm of Hg. So this is the partial pressure of oxygen and carbon dioxide in the situation of ventilation perfusion ratio 0. Next and the last situation, that is ventilation perfusion ratio is normal. That is 0.8. Yani ventilation is also there, perfusion is also there. Sorry, perfusion is also there. So there is gaseous exchange. And gaseous exchange की वजह से हमारा partial pressure of oxygen and carbon dioxide change होगा. तो partial pressure of oxygen and alveolar level is 100 mm of Hg. Partial pressure of carbon dioxide at the level of alveolus is 40 mm of Hg in this situation. ठीक है, is this clear? अब इसी को हम तीनों पॉइंट को मिला के ग्राफ प्लॉट करते हैं, that is known as oxygen and carbon dioxide diagram or ventilation perfusion diagram. ठीक है, first point is this ventilation perfusion ratio is infinite. जहाँ पे ventilation was there but there was no perfusion, तो partial pressure of oxygen at the level of alveoli is same to the inspired air. ठीक है, inspired air में oxygen content is 149 mm of Hg. Partial pressure of carbon dioxide in inspired air is 0 mm of Hg. तो पॉइंट कहाँ जाएगा हमारा? बिकॉज हमने x एक्सिस पे तो ऑक्सीजन का पार्शियल प्रेशर लिया, y एक्सिस पे कार्बन डाइऑक्साइड का लिया. तो कार्बन डाइऑक्साइड का प्रेशर सिचुएशन पे 0. नेक्स्ट इज वेंटिलेशन परफ्यूजन रेशियो 0, जहाँ पे वेंटिलेशन इज नॉट देयर बट देयर इज अ परफ्यूजन. तो सिचुएशन में पार्शियल प्रेशर ऑफ ऑक्सीजन एट द लेवल ऑफ एल्वेलस इज 40, partial pressure of carbon dioxide level is 45. तो ये पॉइंट आ गया हमारा. वेंटिलेशन परफ्यूजन नॉर्मल दैट इज 0.8. उस सिचुएशन में पार्शियल प्रेशर ऑफ ऑक्सीजन कितना होता है? 104 mm of Hg एंड पार्शियल प्रेशर ऑफ कार्बन डाइऑक्साइड कितना होता है? 40 mm of Hg. तो ये थर्ड पॉइंट आ गया. इन 3 पॉइंट्स को व्हेन वी जॉइन वी गेट दिस ऑक्सीजन कार्बन डाइऑक्साइड. ठीक है, समझ में आया सभी को? एवरीबडी इज दिस क्लियर? अभी तक सेशन में किसी को कोई डाउट है तो क्लियर कर सकते हैं, क्योंकि नेक्स्ट अब हम क्वेश्चन पार्ट स्टार्ट करेंगे. एवरीबडी इज दिस क्लियर? डू रिप्लाई फास्ट. किसी को भी कोई डाउट है तो क्लियर कर सकते हैं. एनी क्वेरी टिल नाउ यू कैन आस्क इन दिस सेशन ओनली. चलो फिर क्वेश्चन पार्ट स्टार्ट करते हैं. First question of today's section. Transport of carbon monoxide is diffusion limited. Why is it so? High affinity of carbon monoxide for hemoglobin. Alveolar membrane is less permeable to carbon monoxide. Carbon monoxide crosses epithelial barriers slowly. On exposure to air, there is a sudden increase in partial pressure. So everybody answer this question. Transport of carbon monoxide is diffusion limited. Why is it so? Everybody answer this question. ट्रांसपोर्ट ऑफ कार्बन मोनोऑक्साइड इज डिफ्यूजन लिमिटेड. डिफ्यूजन कब होता है? जब हमारा गैस हमारा प्लाज्मा में डिजोल्व हो, देन ओनली डिफ्यूजन अकर, क्योंकि उसी की वजह से कंसंट्रेशन ग्रेडियंट आएगा, पार्शियल प्रेशर होगा. बट कार्बन मोनोऑक्साइड की एफिनिटी टुवर्ड्स हीमोग्लोबिन इज 210 टाइम्स मोर. So all the carbon monoxide bind with the hemoglobin, no binding with the plasma. So that's why it is diffusion limited. Answer is A. Clear everyone? Moving further to the next question. Carbon dioxide is primarily transported in arterial blood as dissolved from carbonic acid, carb amino, hemoglobin, bicarbonate. Easy, I guess. Carbon dioxide is primarily transported in arterial blood. Carbon dioxide is primarily transported in arterial blood as it is primarily transported in the form of bicarbonate. 70% in the form of bicarbonate. Coming to the next one, carbon dioxide diffuses more easily through the respiratory membrane as compared to oxygen. Why is it so? It is less dense, more soluble in plasma, less molecular weight, less partial pressure of carbon dioxide in the alveoli. Everybody answer this question. Carbon dioxide diffuses more easily through the respiratory membrane. Why is it so? Because it is 20 times more soluble in plasma. Answer is B. Coming to the next question. In mouth-to-mouth respiration, we provide an oxygen concentration of 16%, 20%, 22% or 24%. In mouth-to-mouth respiration, we are providing the 16% oxygen. Our expired air consists of 16% of oxygen. So answer is 16%. Is this clear with everybody? Moving to the next question. Fraction of inspired air in the mouth-to-mouth respiration is 0.16, 0.19, 0.21 or 0.26. Everybody answer this question. Fraction of inspired air in mouth-to-mouth respiration is it is 0.16, very true. Coming to the next one, arterial carbon dioxide level is partial pressure of carbon dioxide in arterial blood is 40 mm of Hg, 37 mm of Hg, 45 mm of Hg, 60 mm of Hg or 42 mm of Hg. Everybody answer this question. Everybody answer this question. Arterial carbon dioxide level is partial pressure of carbon dioxide in artery is 40 mm of Hg. Answer is A. Coming to the next one. Oxygen, which is about 21% of inspired air, exert a partial pressure of 160, 240, 580 or 760 mm of Hg. Everybody answer this question. Oxygen, which is 21% of inspired air, exert a partial pressure of 160 mm of Hg, क्योंकि हमारा जो barometric pressure है 760, इसका 21% is 160. Coming to the next one. One intern calculated the concentration of oxygen in the blood is 0.002 ml per ml of blood. Considering the atmospheric pressure of 760 mm of Hg, how much approximate oxygen tension could have been in the blood? ठीक है? We have to calculate oxygen tension. Everybody answer this question. Everybody answer this question. What we have to calculate? We have to calculate the partial pressure of oxygen. फॉर्मूला क्या होता है? डिसॉल्व ऑक्सीजन कंटेंट इज इक्वल टू पार्शियल प्रेशर ऑफ ऑक्सीजन इनटू सॉल्युबिलिटी कोएफिशिएंट ऑफ ऑक्सीजन. So this is the formula. Do remember everybody? Oxygen concentration is equal to partial pressure of oxygen into solubility coefficient. And we all know solubility coefficient, normal solubility coefficient of oxygen is 0.003 ml per 100 ml per mm of Hg. 0.003 ml per 100 ml per mm of Hg. So this is the normal solubility coefficient. तो इससे हम ऑक्सीजन कंटेंट निकाल सकते हैं, डिसॉल्व ऑक्सीजन कंटेंट. इज दिस क्लियर विद एवरीबॉडी? ऑक्सीजन कंटेंट हमारा गिवन है, दैट इज 0.00225 ml per ml of blood. पार्शियल प्रेशर निकालना है, सॉल्युबिलिटी कोएफिशिएंट इज गिवन, सो फॉर्मूला से हो जाएगा. एवरीबॉडी, इज दिस क्लियर? चलो, मूविंग टू द नेक्स्ट क्वेश्चन. Which of the following statement is or are true about the ODC curve? Fetal hemoglobin shift the curves toward left. Hypothermia shift the curve towards left. Hypercarbia shift the curve towards right. Left shift causes more release to the tissue. Which of the following statement is or are true for OHDC? Which of the following statement is or are true for OHDC? OHDC के लिए फिटल हीमोग्लोबिन में हमारा ODC कर्व शिफ्ट टुवर्ड्स लेफ्ट, हाइपोथर्मिया में OHDC कर्व शिफ्ट टुवर्ड्स लेफ्ट. So answer is both A and B. Is this clear? Coming to the next one. Oxygen delivery to the tissue is decreased by decreased hemoglobin level, decreased partial pressure of oxygen, increased partial pressure of carbon dioxide, increased bicarbonate, or increased pH? Everybody answer this question. Oxygen delivery to the tissue is decreased by ऑक्सीजन डिलीवरी ऑब्वियसली हीमोग्लोबिन कम होगा तो ऑक्सीजन डिलीवरी टू द टिश्यू डिक्रीज होगा increased pH में हमारा OHDC curve shift toward left, so there will be less delivery of oxygen to the tissue. So answer is both A and E. Is this clear with everybody? Do reply fast. Is this clear? Moving to the next question. Fetal hemoglobin has higher affinity of oxygen due to decreased 2,3-diphosphoglycerate concentration, reduced pH, increased release of carbon dioxide, OHDC shifted towards right. Fetal hemoglobin has a higher affinity for oxygen due to fetal hemoglobin has higher affinity for oxygen because of its decreased 2,3-diphosphoglycerate concentration. Coming to the next, an increase in which of the following parameter will shift the ODC curve towards left? Increased temperature, increased partial pressure of carbon dioxide, increased 2,3-diphosphoglycerate, increased oxygen affinity for the hemoglobin. Everybody answer this question. Increase in which of the following parameter will shift the OHDC to the left? Everybody answer this question. OHDC curve left shift कब होगा? It occurs when there is an increased oxygen affinity of hemoglobin. Then only this ODC curve shift towards left. So answer is D only. Coming to the next one. Oxygen affinity is increased by all of the following except alkalosis, hypoxia, increased fetal hemoglobin, or hypothermia. All of the following except oxygen affinity is increased by all of the following except Everybody answer this question. Oxygen affinities increase by all of the following except हमारा alkalosis situation में oxygen affinities decrease sorry alkalosis situation में oxygen affinity increase होता है, fetal hemoglobin में oxygen affinity increase होता है, hypothermia में oxygen affinity increases, hypoxia में oxygen affinity decreases, so there is a release of oxygen. So answer is B only. Coming to the next one. Factor responsible for the left shift of ODC curve is increase in 2,3-diphosphoglycerate, fall in temperature, fall in pH, increase level of carbon dioxide in the blood. Everybody answer this question. चलिए आंसर कीजिए. Left shift of ODC curve कब होता है? Fall in temperature causes this left shift of OHDC. Coming to the next. All of the following factor influence hemoglobin dissociation curve except chloride ion concentration, carbon dioxide tension, temperature or 2,3-diphosphoglycerate level. Everybody answer this question. Everybody answer this question. No, the chloride ion concentration doesn't affect our OHDC. Answer is A only. Coming to the next one. OHDC is shifted towards right in all except hypercapnia, rise in temperature, raise 2,3-diphosphoglycerate level or metabolic alkalosis. OHDC curve shifted towards right in all except. Everybody answer this question. OHDC curve shifted to right except OHDC curve alkalosis में हमारा left shift होता है, not right shift. The answer is D only. Is this clear? No. 2,3 diphosphoryl level increase होगा, ODC curve will shift towards right. Not this question is asking except. Next question. OHDC curve के regarding which statement is true? Acidosis causes the shift towards right. Increased carbon dioxide shift the curve towards left. Hypoxia shift the curve to the left. 2,3 diphosphoglycerate has no effect on the curve. True statement about the OHDC is everybody answer this question. Everybody answer this question. Everybody. Acidosis situation में हमारा ODC कर्व राइट शिफ्ट होता है. This is true. ठीक है. Coming to the next question. ODC curve shift towards the right except diabetic ketoacidosis, blood transfusion, high altitude or anemia. OHDC curve shift towards right in all situation except OHDC curve shift to right in all situation except everybody answer is blood transfusion B. Why is it so? Because blood transfusion में we are giving the stored blood and stored blood जब दे रहे हैं तो glycolysis क्या हो जाएगा? Inhibit हो जाएगा. Glycolysis will be inhibited and since glycolysis is inhibited, yeah, very true, it is blood transfusion. Glycolysis अगर inhibit होगा तो 2,3 diphosphoglycerate will not be formed. So when 2,3 diphosphoglycerate is not formed, हमारा ODC curve left shift होगा, not the right shift. So answer is B. Very good. Coming to the next one. During exercise, increase in oxygen delivery to the muscle is because of all except ODC curve shift towards left, increase stroke volume, increase extraction of oxygen blood, increase blood flow to the muscle. During exercise, there is an increase in oxygen delivery to the muscle is because of all except So everybody answer this question. OHDC curve is sigmoid. Why is it so? which DC curve sigmoid is because of theory of cooperativity, which state that binding of one oxygen molecule increases the affinity of binding of rest oxygen molecule. So answer is A. Coming to the next question. Which of the following doesn't occur as the blood passes through systemic capillary? Increased protein content, shift of ODC curve to the left, increased hematocrit, or decreased pH? Chalo, everybody answer this question. Excuse me. Which of the following doesn't occur as the blood passes through systemic capillaries? Everybody answer this question.